So welcome everybody, and we could just come up to 5 past, so I think I'll get started. I know not everybody that we sent the invites to has been able to join. It is August and I didn't give a huge amount of notice, so apologies about that. But I am hopefully recording this, so those that haven't been able to join, if you encourage them and you might want to recommend that they see this video afterwards, they're more than welcome. And I've tried to invite a wide selection of our senior leaders, chairs of our staff networks, key people across the organisation, just to talk through what's next in terms of COVID response. And the reason that I wanted to invite people now is it just felt as though we're in the midst of having to respond to the latest round of planning guidance. I know that's going to keep people busy over the coming months. We're still operating in a very different way in response to COVID, and there's still a huge amount of uncertainty as to how we continue to run our services with potential outbreaks, what it means for our staff, what it means for our service users. And you don't need me to kind of give you all the list of the other confounding and competing risks and issues. But I was also conscious of, we're more than halfway through the calendar year. A lot has happened and people are at different places in terms of energy levels, where people's heads are at, whether people are feeling up and down, whether people are feeling well connected, or people are just a bit knackered, in need of a break, and things are feeling quite difficult at the moment. And as ever, I mean, we've just had this morning in EMT the first report from the All Voice Counts, and as ever there's a variable picture in what it feels like for people at the moment, and that consistency is something that we're always going to have to continue to work at. So this is about me setting out next steps, but before I go into that, I suppose I wanted to reflect on what happened before COVID, because we never really got a chance to say that direct thank you and celebrate for all the fantastic work that was taking place. And if I think about the starting point of that being after our Trust Awards, because that was our kind of moment in the year where we do some really formal celebrations, there's a number of things happened, didn't they, that we need to remind ourselves of. We achieved a good in our CQC rating and huge improvements across a number of our services. So well done to all of you. We got our staff survey results and again, significant improvements across a number of areas of feedback from our staff of what it feels like to work in our organisation. We continued with a whole range of service transformation and service improvement programmes, and we were expanding and securing new business in some of our areas, really attached to our expertise when you think about our veteran services, the work we're doing on devolved commissioning from SpecCom, the increasing leadership role we're playing within the local and the regional systems. And we got over the line on turning on our new electronic patient record system, Care Director, which is a fantastic achievement. And again, when I say all of this now, if I have one regret over the last 6 months is that we've not had the time to really show enough in terms of thank yous and appreciations and celebrating the fantastic work that yous are all party to and the difference that you all make. Because what we're very good at doing, myself included, is to say, well, what is it we still need to do? What are the areas we still need to tackle? And there are lots of areas we need to tackle. And whilst I am really proud of and really delighted of all the progress that we've made, there's some honest reflections that we need to have of where we're not making enough difference. So what I tried to do in setting out the COVID response, and we did this reflecting on some of the feedback that was coming through Your Voice Counts and through people that are on this call, and we had a discussion as an executive team and a discussion as a board. What really helped during the early days of COVID is that real sense of united against one common purpose, and so we need to hold on to that as much as we can. So when we thought about, well, what was our common purpose next, it's that, and it's a really a strange one to try and say it's definitive, but the big thing for me is that our ability to be flexible and adapt what we're doing and constantly have to respond to a changing environment around us is incredibly important, both in terms of keeping people safe from coronavirus, but responding to the health and well-being of our staff and flexing in response to that and what works for them, but also the rising demand that we're seeing for our mental health and our learning disability services. And the only way we're going to do that is about taking risks, being agile by ensuring that decisions are taken as where in those teams that are best placed to make those decisions. And I'm hearing this kind of sense of what we don't want to do is revert back to this kind of control and command where people don't feel able to make decisions or don't know where decisions are being made. So the whole point of being able to communicate this to everybody at the same time is to say that is absolutely where we as a board, as an executive team, want things to be in terms of the culture of this organisation. As said from the day that I joined, I remember going out doing those early engagement sessions around all the different sites in the trust with variable levels of attendance. I think I'll park them in future and stick to Zoom because you get a lot more people willing to come and join. That actually the expertise sits out in our services. That's why we employ over 3,000 staff with a whole range of skills, from clinical skills through to specialist skills in IT, in our estates and facilities, in our workforce and OD. We need all of those skills, and all of those skills need to come and work together. The other reflection that I've got is, again, from one of those early conversations that I've been mulling over in the last few days, is I went to one of the sites and what they said was, can we just have a rest from change for a bit? It feels like things are always changing and it's really hard, and it is really hard, isn't it? But actually, for some people, change can't come soon enough, and we've not done enough in terms of delivering change. And when I think about that, I've got people at the heart of the stuff that really plays on my mind. And again, some of you will know this, and some of this is centres on where I do step in and reach out and want to intervene, is when I hear accounts from our service users that come through and our complaints, or in RSIs, when I hear about the experiences and accounts from our staff where we've not got it right. And that's not because the intent hasn't been there. It's because we're complex and we're organised in complex ways, and sometimes things get in the way, or we don't allow people enough space to reflect or to make those changes themselves. And that's the stuff that, from a values point of view, is what I find the hardest and keen to make the biggest difference on. So for those of us that say, can we have a rest from the change, the things we need to hold in mind is those people that where change hasn't come fast enough. And I'm just going to be really explicit about those particular areas. People with mental health and learning disabilities die significantly many years sooner than anybody else because of the disadvantage and the discrimination that they experience. There's something we can do about that. We've got service users and we've got staff that are from our Black, Asian, minority ethnic communities, that have got disabilities, that are LGBT, that repeatedly, in all of my 20 odd years in the NHS, have told us they experience discrimination, they experience racism, they experience unfair opportunities, and as a consequence of that, adverse outcomes. Change can't come soon enough for those people who are on the receiving end of where we're not getting things right. So that's why, in terms of how we're going to do this, how we are going to lead our organisation, those principles in the blue box are really important. So when we talk about change, actually, the biggest thing we can do is engage with everybody that's affected by it. And when I talk about making everyone matter and leaving no one behind, this is very much that we need to confront inequality head on. We need to ask the difficult questions. We need to seek out the experiences of those where we're not getting it right. When I read all the comments that came through the Your Voice Counts platform, of course I love reading the positive ones. Absolutely, we all do, don't we? We all want to get the positive feedback. And when we say feedback's really important, we always do it from a starting point. If we want to hear the good stuff, nobody ever wants to hear the bad stuff. But we've got to seek out the bad stuff. And if you think about the sessions with Michael West, the one thing he always talks about from a board point of view, the best boards are those that are seeking out the dark spots. Well, I think that principle applies to everything that we do. We could take comfort in the areas that we're getting it right, but then we could easily become blinded to the areas where we've got more work to do and where we need to really make a difference. And the other bit that then makes me think about, just to go off on a tangent, because I've not written any of this down. People that know me know I'm an introvert, so I've been thinking about the key messages to get across for several days, and they'll just come out as they come out when the time comes. We all love to be able to step into that role and help make a difference. The risk for us is if we see that as being rescuers. And we all come into the health and care sector because we want to support others. But actually, if we adopt the position of rescuing, and those people on this call will know far more in detail about drama triangles than I do, then that always means that somebody's got to be a victim. And it always means that somebody's got to be a persecutor. That's not the place that we want to be in terms of culture change. And so it's how do we move into a space of operating as adults. And when we operate as adults, it's about how do we take accountability for our own contribution in perpetuating or failing to change the challenges that we face, and how do we support others to move into that adult space. And the one, again, I've been reflecting of the one example that I see of where that really operates in that adult space is the REN meetings. So having joined them, to my shame, I didn't join them since it was launched up until we were in the midst of COVID. A big regret I've got in that, but that is a space that operates in the adult. People do share difficult experiences and people share the efforts that they're taking, but nobody steps into being a victim, nobody steps into being a rescuer, and certainly nobody's put in the position of being a persecutor, because that closes down the ability to listen and to learn and to take accountability for what your own responsibility is to make a difference. So this is then point 4, recognising people, recognising we're all individuals, we need person-centred approaches, and that comes from understanding ourselves and being curious about others. So the other, what kind of influenced my thinking in terms of today's session is tensions have been high in the last couple of weeks. I understand that we're all under pressure. And the bit is difficult, isn't it? If when we're all under pressure, our heads are down and we're trying to cope, and we can get, and myself included, a bit not compassionate towards ourselves or towards others. So the bit I want us to think about, and I'm asking you all to think about, when you're under pressure, not only is it about them being able to ask for help, but ask what it's feeling like for others as well. Because if you're under pressure, the person that you're interacting with is no doubt under a similar amount of pressure. It might just come from different sources. So that curiosity about what's going on for other people within our leadership community, I think, is really important, and will go a great deal to enable us to be able to ask one another for help more than we currently do. And that nicely leads on to then, how do we, under point 5, value all contributions and all of the teams and all functions and all specialities equally? Because we've got to do that. Nobody is more important than the other. And there's a danger, isn't there? We've had to make some really tough decisions about prioritising services during COVID, and it's absolutely the right thing to do. And I wouldn't change any of that. But that was about prioritising on the basis of safety and of risk, not on what was valued. And that's the message we need to give back to those teams and those other services, those staff that we've redeployed. This isn't because the job that you did before wasn't valued, but at this point in time, we are prioritising on the basis of need and of risk and how we can keep each other safe. And we need to hold that as we start to move into the next phase of valuing all of the teams and getting it right for everybody. And what sits at the heart of all of this is our safe, reliable and effective care framework to improve quality. And when you look at that, again, hopefully you're all familiar with it. This is where we really refer back to the conditions that we create around psychological safety that makes people feel safe to speak out, to contribute, to feel safe and to feel valued, skills in negotiation, in resolving conflict, how do we seek feedback and use the intelligence and the information and the data around us to go around that loop of learning and improvement. And the only way we'll be able to keep all of our staff, service users and citizens safe, as far as I'm concerned, is by following all of those principles above and holding on to that adaptability and that flexibility and that way of working. So the things that we need to be clear on, and I wish there was an alternative to this, but we've lived and breathed it only in the last week. We're going to have further cases of COVID, and we'll continue to have further cases of COVID until this vaccine, cure, whatever it is, appears, and that's not going to be on the horizon anytime soon. And last week, when we had a case of COVID in our older adults, what we actually saw was some of the best joint working across our clinical teams in the older adult service, the senior leadership team, our infection prevention team, our workforce team, the EPRR team, all came together and wrapped around so that very quickly we knew what we were dealing with. The impact of that was managed really well, so it didn't disrupt the rest of the organisation. And thank you, because it's all credit to a huge amount of work over and above what people were already doing on those days. That meant that was very well managed. The staff wellbeing and the new wellbeing framework, we've got over 70% of our staff now have had those assessments. We need to get that to 100%, not because I want the 100% target, because I want every member of staff to have had that conversation about how it's feeling for them, what support that they need, because in terms of recognising people and having person-centred approaches, that is a way in to keep people at the heart of our decision making at a very local level as well as at a trust-wide level. And making sure that people are really explicit and able to be really explicit around what works for them. Again, some really, it was Dawn that phrased it. We heard some feedback from the Your Voice Counts platform, which was really sad. Staff that are working from home, great, but not sure if they need permission to be able to do other things around the house, like get your washing done, hang your washing out. We don't want a culture where everybody needs permission. What matters is, are you doing the job in the way that we need you to do it in terms of impact, outcomes? Are you well supported? Are you well connected? If you want to nip out and get your shopping, do whatever it is that you need to do. We're all adults. Again, that's about in that adult space, not this permissive space where people are feeling they need permission to do what some of us would, do without even thinking. In terms of our resources, it is difficult, and it can continue to be difficult. And again, some of you have heard me say this. We are living the legacy of years and years of driving cost efficiencies by reducing our reliance on estate. Second to after staff, it's our biggest expenditure. And we've had targets last year. We had a whole set of targets imposed on us by NHS Improvement on the amount of estate we were using and what were our plans to use it under the Carter efficiencies, and we should all share. Well, I'm sure people will be wanting to go and hide that Carter review, considering it serves us no use whatsoever in being able to safely operate during a pandemic. So we don't have enough estate to operate safely for all the services that we currently provide. So the only way we're going to be able to get through, again, comes back to that being flexible, being adaptive, taking some risks, innovating, trying things that may or may not work, and that be around flexing the way we use estate, teams operating differently in terms of who comes in when, but really importantly, how do we use our technology in a different way, which frees people up, which gives a different option for service users to be able to access our services and staff to be able to operate in a more flexible way. Easy to say, hard to do. But this approach that we're taking in terms of flexible, agile, remote working, investing in technology won't end when there's a vaccine found for COVID. Because actually staff don't want it to end when there's a vaccine found for COVID. A lot of the feedback in the Your Voice Counts is we want some of this to continue. But equally, there are some of our staff that are finding it really hard working from home and need to come in and work from trust premises. So we've got to get the balance for both of those. We need to update this now because we're no longer in a national level 4 major incident. It's been stood down to a level 3 major incident, and that's why we're now in the midst of having to respond to a whole swathe of planning guidance and still waiting to see what the new financial framework looks like. However, we're still managing a major incident in terms of the risk of COVID and operating in a very different way. And we're still having to do the same level of reporting to the centre. So some of that stuff which people like Andrew and the EPRR team and Alison and Lizzie do behind the scenes will continue. And it's an important job that they do on our behalf. And again, some of you already know this, in terms of that wider picture, we need to continue to have arrangements in place in terms of track and trace, in swabbing. Testing is going to have to increase. I think there's an expectation that we'll start to do more routine testing of our staff. So a lot of our what classed as corporate teams already work now 7 days a week and will continue to do so. So their operating model will continue to be very different, in the same way that the operating model for our clinical services will be very different, in the same way that my expectation of the operating model for the executive team is already very different and will continue to be very different. The changes apply to all of us. We are seeing, and you are all seeing, the impact of COVID in terms of demand. That's going to increase. You can't help but see the news each day, and the further announcements of redundancies, more people out of work. We know that has a direct impact on people's mental health and well-being, has an impact on things like domestic violence, on safeguarding, because the pressure that it puts families under. So we need to be able to respond to that with partners. Not all of it is about a specialist mental health response, but we've also got an obligation, haven't we, in terms of we've got lots of vacancies, so we want as many people to come and work for us as possible. It often gets described as health and care sectors are harbour employers because they're a safe place to go when there's wider economic uncertainty. So we mustn't rest on our laurels in terms of our recruitment activity in order to have that double benefit of recruiting staff that want to come and work with us and make a difference, and therefore offsetting the economic downturn and the effect of unemployment on people. The mental health investment standard continues to be a national commitment. We don't yet know what the financial modelling is going to look like over the next couple of years, but we're really being clear in our expectations to continue to see that investment coming through, and therefore we should be planning to spend it. We had an exec to exec with the Leeds ECG just a few weeks ago. We're really clear all the commitments that they made pre-COVID in terms of investment in mental health. Their governing bodies still expecting that that commitment will continue, whatever the financial framework looks like. And week by week, policy and guidance changes will keep coming to some extent. There's not a huge amount we can do about that, although I am glad the daily press briefings from the government have finished, because that seemed to be the way we were always on the back foot, finding out things on a Friday tea time. That just creates uncertainty for our staff. So the kind of final quote that you've got there in the middle, I'm going to read out is, and this applies to every single one of us and all the teams that we operate within. No team or service is an island, and the ideas and solutions will only come from working with other teams and departments. And I've always said, one team's problem is something that another team in this organisation is absolutely fantastic at, and if only they could connect in some way, they'd be able to support one another with those solutions. This comes back to this principle of how do we ask for help rather than feel as though we've got to have all the answers ourselves. And again, some of the feedback that I've had through COVID, as much as some people loathe Zoom and some people love it, it does make it sometimes easier to connect and get more people together. And a few of our clinical staff have said, actually, I've had conversations with teams based on patients that I would never have had a connection with, and that's the stuff that I want to continue with even when we're not in a major pandemic. So the point of that is the technology is there to be used in any which way you see a benefit. It's not something that needs a trust strategy for. It's not something people need permission for. It's what I expect people to get on and do. And similarly, each team should think about what they can and do and should offer to others. And that's my ask in terms of that compassionate collective culture of what help do you need, but equally where can you help and make a difference to others. So that's all that I was wanting to say. I'll probably, being an introvert, remember a load of things afterwards that have been mulling around on my morning runs that I was going to share with you, but only I'll know that. You won't know it, is the bit that I've learned to tell myself as well. So I'm going to finish it with thank you for joining today. If you don't hear it enough, thank you, every single one of you, for everything that you did pre-COVID, for everything that you've done during COVID, and for everything that we're all going to do together in terms of the next phase of leading LYPFT. I look forward to a time when we don't define things as pre, during, post-COVID. All of this will just be how we do things around here in terms of the culture that we're trying to create. But if there's one thing, again, I just want to finish with, is a huge thank you, and please just leave this with that real focus on how do we just make everyone matter, and how do we leave nobody behind, because that for me is about how we have that truly inclusive culture.